In this short video tutorial, we will be discussing and memorizing the mnemonics for the theorems of the retention relapse. So it start from the mnemonics is T-C-O-O-T-I-G-A-F. So we T for tend. The teeth tend to come back to its original position. C stand for cause. The cause of the malocclusion, just like for example, if the patient is doing thumb sucking, so the cause of the malocclusion must be corrected first before doing the treatment. Then this 1O stand for overcorrection. So the teeth, for example, the rotations and the rotation and the expansion, and there are many type of malocclusion that should be overcorrected so that you can prevent the relapse. The other cause is occlusion. O stand for occlusion. The teeth must be in a proper interdigitations and in the proper occlusion to prevent the relapse. And this T for time. The teeth and periodontium should be allowed to have some time for the reorganization, for the remodeling. So to prevent the relapse, the teeth and the periodontium should be allowed to have some time in a new position, so that to prevent the relapse. Then is I stand for incisor. Okay, the incisor should be upright over the basal position for the proper occlusion. I stand for incisor. G stand for growth. The treatment carried out during the growth are less likely to relapse. A for the arch form. The arch form should not be changed, especially the mandibular arch form should not be changed. And F stand for further. F for further. The further the teeth you have moved, this is less likely to come back to its original position. So for example, if you moved a tooth 10 millimeter, so it's not go back to its original position. So the further you have moved the tooth, it is less likely to relapse. So you stand for T-C-O-O-T-I-G-A-F. T stand for the teeth tend to come back to its original position. T stand for tend. C stand for the cause. 1O stand for occlusion. The other stand for overcorrection. T for time. The teeth should be having some ample amount of time in a new position for the reorganization. A stand for incisor. The incisor should be upright over the basal bone. G for the growth. The treatment carried out during the growth are less likely to relapse. A for arch form. The arch form should not be changed, especially the mandibular arch form. F for further. The further you have moved a tooth, it is less likely to relapse. There is another theorem, which is the 10th theorem, that is there are certain malocclusion, for example diastema or generalized spacing, that need permanent retention. So the theorem 10 is there is certain malocclusion that needs permanent or fixed retainer. So T-C-O-O-T-I-G-A-F. T for the teeth tend to come back. C for the cause of the malocclusion should be corrected. O for occlusion. Proper occlusion must be there at the end of the occlusion. O for overcorrection, that there are certain malocclusion that should be overcorrected. T for time. I-G-A-F. I for incisor. The lower incisor must be upright over the basal bone. G for the treatment carried out during the growth are more stable. A for arch form should not be changed, or F for the further teeth have been moved. And the theorem 10 is there are certain malocclusion that requires the proper retention. Thank you.